Good morning. This is Dr. Allan Hernandez. I'm an internist endocrinologist. So this morning we'll be talking about the complications of diabetes mellitus. A lot of patients, diabetic patients, don't really realize it, but the more important reason why they are taking medications to control their blood sugar is primarily to prevent the long-term complications of diabetes. It is not just to control the symptoms, but primarily to prevent long-term complications. So what are those long-term complications? Number one, diabetics have a 2 to 3-fold higher risk for strokes or cerebrovascular disorders. That's when half one side of your body can become paralyzed. Or sometimes you may even end up comatose. So diabetics have a higher risk for that compared to ordinary individuals who don't have diabetes. Similarly, diabetics have a 2 to 3-fold higher risk as well for heart attacks or cardiovascular coronary artery disease rather. So symptoms would include chest pain. They're usually stabbing or chest heaviness or tightness, usually in the sternal area, sometimes on the left side of the chest. But bear in mind that 20% of patients who experience heart attacks don't have symptoms of chest pain whatsoever, and almost all of them are diabetics. So that's the worrisome thing about it. And then retinopathy. Diabetes is the most important cause for blindness among adults when the retina has been affected. That is why you hear of cases of patients getting laser therapy for the eyes. That's to prevent the progression of the retinopathy, to prevent the blindness. And then you have diabetic nephropathy or kidneys, the kidney involvement. Diabetes is the most important cause of hemodialysis. Now, hypertension is also another important cause, but the most important cause is actually diabetes. So it's an expensive complication, and unfortunately, in most cases, it is for the rest of their lives. So that's another important reason why we need to control the blood sugar to prevent hemodialysis or kidney failure from occurring. You cannot prevent it, might at least be able to delay it. The fastest that I've seen in my own practice where a patient was diagnosed but did not do anything about it, no medications were taken, no follow-ups were done. The fastest from diagnosis to reaching kidney failure was about 5 years for that particular patient. I saw her only once when she was diagnosed and then did not follow up anymore thereafter, but I was able to keep track of her, and unfortunately, no matter what I told her, she did not want to follow up. So nothing was done. They did not do anything about her disease. 5 years later, she had kidney failure and dialysis, and a couple of years later, she expired. Fortunately, it could have been prevented. And then you have diabetic neuropathy, when the nerves are involved. So the patients would usually present with numbness, decreased sensation, mostly on the lower extremities, but also can happen also on the upper extremities or the arms, usually on the legs or the feet. And other than numbness, the patients may sometimes experience pain or tingling sensation or pin and needle sensations on the soles of the feet, for example. So, and in some cases, it could be so extreme that the patient may, may not feel it when they're stepping on sharp objects. That is why the patients with neuropathic problems already are advised not to walk around with naked feet. They should have slippers or rubber shoes on, because it can be dangerous. No? And then you have peripheral vascular or peripheral arterial disease. No? When the blood supply to the lower extremities mostly, but also on the upper extremities are involved. No? And so the blood supply is decreased, and gradually the patients may end up with gangrene. No? And in a lot of cases, coupled with the neuropathic problem of decreased sensation, this can lead to severe gangrene to the point where you might have to amputate the foot. No? Now, going back to the neuropathic problem, a sad complication for males particularly is the problem of erectile dysfunction. Around 50% of diabetic males, when they reach 50 years old, will experience problems of erectile dysfunction. This is when the penis can no longer erect properly, and the patients may not be able to function sexually. So it's a rather sad, actually, complication. So it's sad not only for the patient involved, but also for the partner. So those are the common complications of diabetes. So this is our short medical topic for this morning. I hope you learned something. We'll be expounding on those topics as we go along our lecture series. So this is your host, Dr. Allan Hernandez, and good morning to you all. Thank you very much.